Like everything else, the pandemic of COVID-19 has also had a significant impact on cancer care systems in Canada. There were interruptions and delays in sectors across the care pathway from prevention to palliative care. There were people who had their screenings halted, treatments delayed, and surgeries cancelled owing to the pandemic. Not only does it take on a toll on your physical health, but also has emotional repercussions. Imagine living through the midst of COVID-19 like that. What does it tell us about the real world context? Pandemics like COVID-19 allow for reflecting on the needs and gaps of the healthcare system and present with an opportunity to restructure and re engineer the current policies to build back stronger. To precisely address this, Colorectal Cancer Canada initiated the Ready for the Next Round program. We wanted to explore the impact of COVID-19 on cancer care and control. And we also wanted to foster ideas, strategies, and solutions to address the current backlogs and prevent future interruptions in cancer care. We did this by conducting a series of 4 thought leadership roundtables involving different stakeholders, patients themselves, physicians, healthcare system leaders, and researchers across Canada. We want them to discuss and come up with recommendations and solutions to answer questions like how do we mitigate the impact of the COVID-19 pandemic on the current oncology community? How did the COVID-19 pandemic influence the healthcare system to invest in up-to-date information and timely access to health-related data? Should telehealth be something that stays even after the pandemic? How can a more patient-centric approach be useful in addressing oncology care? And how do you think patient advocacy groups and nonprofit organizations can support the healthcare system in the midst of a crisis? Above all, the most important question, how should a once in a century crisis like COVID-19 be met with a commitment to build a more resilient healthcare system for Canada? The recommendations that we got from our panelists were targeted to the federal, the provincial government, and the territorial healthcare professionals, researchers, as well as policy advisors who are directly or indirectly involved in the provision of cancer care and control services in Canada. We aim with this program to strengthen the Canadian healthcare and research system to build a more resilient design that can respond better to future crises. And why so? So that we are ready for the next round. Thank you.